Being the chair of the Department of Family Medicine, I've had that privilege to have a panel where I have patients that I've taken care of for as much as 3 decades. That is the thing that makes this experience enjoyable, because not only am I taking care of people who need to receive care, I've had an opportunity to interact with them across their entire lives. I've been present at the birth of their children. In fact, I've participated in that. I have watched their children grow up and take care of them as they kind of got out of the house and went on to their respective careers, and have taken care of them as they've aged with me, which has been a beautiful part of this engagement that I've had with patients over time. Working in a complex healthcare system, they need someone who's going to orchestrate their ability to get through all of that and make sure that they remain well. And if they are not well, for them to be able to manage the illnesses that they may have, and to make sure that as they interact with multiple physicians in a healthcare system, that there's one single place where all of that information is consolidated, and at the end of the day, if they want to know what it all means, that they can come to their primary care physician, which is me, to be able to sort all of that stuff out for them. One of the things that I find myself doing most of is taking care of patients who have multiple chronic disease processes. So it may be kidney disease, hypertension, heart disease, all these things in the same individual. And the way that you approach those particular problems are modified by the fact that they have multiple problems sitting there. And that becomes difficult at times. And one of the things I enjoy doing is trying to put some degree of simplicity to this for the patient, so that they can understand how to navigate themselves across a complex array of disease processes for which I may be taking care of, and then, quite frankly, may be taking care of that person who is also being seen by one of my subspecialty colleagues as well. So it's the whole idea of equipping the patient with all the skills and tools necessary to be able to provide the self-management, which is what will have to be done in order for them to maintain their appropriate clinical status, stay well, and to manage their diseases appropriately. And from my perspective, if I look at the patients who come to me, I think that their major motivation is that I am patient-centric. I believe thoroughly in patient and family-centered care. That's the way that I approach all of this. I'm involved not only in the event of the disease, but I'm involved in the patient themselves and that patient's family. That's what being a family doctor is all about.